So I've been thinking about climate change for a while. I think many of us have. And at times it's easy to think of this as something in the distant, out there. At some point, we may have to address it. It is today. It is in my clinic. It is in the hospital where I work. It is in my community where I live.
Hi, my name is Dr. Jay Lemery. I'm an emergency physician and I work at the University of Colorado School of Medicine.
My name is Ashish and I am the Dean of the School of Public Health at Brown University.
I'm Jonathan Patz. I'm a professor and director of the Global Health Institute at the University of Wisconsin in Madison. I first became aware of climate change back during my Master's of Public Health program. I looked into this and I thought, this is a big deal. You know, this is air pollution, population policy, energy policy, and just was an enormous issue that had potential health impacts.
Fossil fuels are dirty fuels and they cause asthma and cardiovascular disease and strokes. Getting off of those fuels and moving towards cleaner energy has these profound effects on our lives that I think we've got to make that transition, not just to run away from something, but towards something else that I think is going to be much, much healthier and better for everybody's health and well-being.
In terms of a patient story that I could share, I work in Colorado and the wildfires in the American West have been prolific this whole summer. And one of the things that we're seeing is patients with pre-existing lung disease, COPD, congestive heart failure, asthma. And when we see our patients and treat them, we write down the cause of their chief complaint. But I don't write down air quality really bad in Colorado. That's so important because there is a cause and effect there.
A couple of summers ago, I took care of a patient, a Vietnam veteran who was hospitalized, basically found at home confused, unable to take care of himself. We very quickly realized that the two things were happening. One was that he was profoundly dehydrated. Boston was suffering an unusual heat wave, and he was on medicines that complicated his fluid management because of cardiovascular disease that he had. And one of the things that we realized at that moment, the number of heat waves, the number of hot days hitting us in Boston, is changing. And it's changing in ways that need for us to change our clinical practice. We have to really think about the medicines we're giving our cardiac patients and think about how they interact in a new climate. When he passed away and talking to his family about his life and his surviving the jungles of Vietnam, and his wife actually brought up the point. She said, you know, after all of that, he succumbed to a heat wave in Boston. And I thought, this is the new reality we're living in. And as clinicians, this is not some theoretical. This is something we have to start taking into account into our clinical practice on a day-to-day basis.
It's impacted me as a caregiver. It's frustrating, right? I know the air quality is being degraded and I see patients who are very vulnerable physiologically coming in with exacerbations that are directly caused by environmental consequences.
So this is not something that's new. I do believe it is essential for physicians to learn about the principles of climate change and how climate change is going to change clinical practice. And then I think it's essential for physicians to advocate for policies that protect our patients by reducing greenhouse gases and ultimately mitigating the negative effects of climate change.
Climate change is a health issue, and physicians really are the right people to be communicating the importance of climate change because it cuts across so many exposure pathways to affect our health. It's absolutely paramount for doctors and nurses and all health professionals to step up and call out climate change for what it is. It's a health emergency.
I work in a community that's underprivileged. It's a poor socioeconomic community, and we're definitely seeing disparities with people of color and socioeconomic vulnerabilities coming in with shortness of breath, you know, from the poor air quality out here.
Here in Madison, Wisconsin, we have many people that live in poor housing with poor ventilation. It may be in flood-prone areas. We've seen major flooding in the Midwestern United States, and the issue of moldy basements, and we see increases in asthma. So I've seen in this community many people that are affected by climate, and especially from flooding and mold exposure.
So patients have been coming in with shortness of breath, often patients with physiologic vulnerabilities, so pre-existing asthma, congestive heart failure, obstructive pulmonary disease. And when they come in, you know, they're not feeling good. They're short of breath. They can't get a reasonable breath of air. They're speaking in short sentences. or even just short word phrases, and they feel miserable. This is something that has really affected people out here.
That I believe climate change is the biggest public health challenge of the 21st century. If we do not tackle it, it will profoundly shape the health of populations locally in Massachusetts and Rhode Island and New York, nationally across the US, and globally across our entire planet.
This should become mainstream in medicine. The effect of climatic extremes, be it from heat waves and worker stress to effects of climate on aeroallergens and ragweed pollen that affects childhood asthma. These are absolutely bread and butter health issues, and climate change should not only be part of the medical school curriculum, but anyone in the healthcare system really needs to step forward and speak to climate change for what it is, a health emergency. Nurses and doctors are the most trusted messengers about climate change. Climate change, it's here, it's now, it's affecting us, it's a health crisis, but it's solvable.
This is not just one of the issues we need to deal with. This is arguably the most pressing public health issue of our times, and we've got to get going on action now.